first, thank you once again for the invitation to speak here. This is just so wonderful. It's probably the best part of it for me is the opportunity to meet people that I don't often see. So, as you know, some of us have had the chance to work together when I was at the bone marrow transplant program at City of Hope at Good Samaritan Hospital. And since then, we haven't met often because I've moved my practice now to join a group in the West Valley. And so we might not get to meet often. But meeting like this is just so wonderful because we get to see each other. And I wish we could do this more frequently and actually meet more often. My background training is in hematology and oncology. And as I just mentioned, I spent 7 years with the bone marrow transplant group dealing primarily with bone marrow transplant. The most common diagnosis for which patients are transplanted across the US today is still multiple myeloma. And if you limit it to autologous transplants, then it's the overwhelming largest group of patients who receive a transplant. Currently, however, I'm in private practice in the West Valley. Today, I thought we might spend a few minutes talking a little bit about a transplant. What is a bone marrow transplant? Why would somebody want to get a bone marrow transplant? When? Should everyone get one? What are some of the pros, cons, and so on? Of course, it's going to be individualized. What will work well for one person might not work well for another person. But I'm just going to try and give some general explanations. So living here in Phoenix, and welcome to Phoenix. It's nice this time of year, but I couldn't help coming in. You look around and there's all the wonderful golf courses and the green grass and the vegetation. It just looks so wonderful. And I just wanted to use that as kind of an illustration of what we do in transplant. So imagine that you owned this piece of land. This was yours, and you owned it. Imagination, and it was all nice green grass and beautiful meadows, and you could just go in there and roll on the grass all day long. And then you came in one day, and that started to happen. So the weeds started to happen, and these bugs. These are bad things. In a very short time, they can wreck an otherwise beautiful lawn or golf course or something like that. So now, let's try and imagine that the bone marrow is that first lawn that you had. And a healthy bone marrow does not have any of these, which are the multiple myeloma cells. So these multiple myeloma cells, which we know, originated from one bad cell. One cell went awry in the bone marrow, and then that cell starts to produce progeny. It starts to give seeds, and they spread, and very soon they spread throughout the bone marrow, and they begin to go to other places, and they begin to have bad effects on that lawn. What can you do? Well, if you're fortunate and these weeds are all in one clump, just in one corner of your lawn, you can wake up early one morning, get some shovel or something and dig it out and throw it away, and end of story. Unfortunately, sometimes it's spread throughout the marrow. Even if it's a small percentage, these weeds will have scattered and spread throughout the area. What then can you do? One of the options is to just call Joe the farmer, who will come with his tiller or grader or whatever it's called and just destroy the whole place, just wipe it all out, and then call his cousin who comes after him and puts new seed in the soil, and that new seed will hopefully germinate and give you once again a nice lawn. Well, that is what we try to duplicate when we're doing a bone marrow transplant. So when a patient has multiple myeloma, it's as though the good normal bone marrow that they have has now developed some abnormal cells mixed in, which are the counterpart of the weeds. And one way to get rid of the weeds is to temporarily destroy the entire bone marrow compartment. we use medications, of course, instead of a tiller. We use medications, get rid of the entire bone marrow, and then, so to speak, replant the bone marrow or retransplant the bone marrow so that you can get a new vibrant growth of new cells. So it's not very technically complicated. It's really quite a straightforward thing, and the components of bone marrow transplant are all things that are well established in medical treatment.